Hello, my name is Inês Nunes da Cunha, and I am the FIP Practice Development and Transformation Project Manager. Welcome to this CPD Bite on the role of pharmacists in tobacco cessation brief interventions. Today, we will look at how pharmacist-led brief interventions can have a significant impact on patients' quit attempts. By the end of this video, you will be able to identify ways in which pharmacists can support patients in quitting tobacco through accessible evidence-based brief interventions. Understand the 5A's and 5R's models, a structured approach for effective tobacco cessation guidance. Apply specific strategies such as the STAR methods to create supportive and personalized quit plans that increase patient success. In this video, we will explore the global burden of tobacco and its impact on non-communicable diseases, NCDs. We will highlight the crucial role pharmacists play in supporting patients to quit tobacco using brief interventions. And I will introduce FIP's new toolkit, Brief Interventions for Tobacco Cessation, a toolkit for pharmacists, a resource designed to equip pharmacists with essential tools to help patients quit tobacco use. Tobacco use is one of the most significant preventable causes of death globally, responsible for more than 8 million deaths each year. Of these, over 7 million are directly linked to tobacco use, while 1.3 million are caused by exposure of non-smokers to secondhand smoke. There are 1.25 billion tobacco users worldwide, and around 80% of them live in low and middle-income countries, where the burden of tobacco-related diseases and death is heaviest and where access to cessation services remains limited. As public health efforts increase, 60% of tobacco users want to quit, but around 70% of them have no access to comprehensive tobacco cessation services due to the challenge faced by health systems, such as limited human and financial resources and limited capacities of tobacco cessation services at the country level. Patients' willingness to quit underlines the importance of expanding access and making tobacco cessation a priority in health systems. Tobacco use has been reported as a major risk factor common to various non-communicable diseases, special chronic respiratory diseases, cardiovascular diseases, cancer, and diabetes, four of the five main United Nations defined NCDs of concern. Worldwide, 14% of all NCD-related deaths of adults aged 30 years and over are attributed to tobacco. Tobacco cessation significantly reduces the risk of various diseases, mainly NCDs. Although the consequences of tobacco use go behind health and affect the economic stability and social well-being of tobacco users and their families, quitting remains a challenging process. Due to the highly addictive nature of tobacco, many users find it difficult to quit on their own and require professional support from healthcare providers to successfully achieve cessation. Only 4% of users are able to quit on their own. However, with support, individuals can achieve a tobacco-free life. Pharmacists, as trusted and highly accessible healthcare professionals, are ideally positioned to provide evidence-based advice, medication, and support for individuals seeking to quit tobacco. Their availability in communities combined with their expertise makes pharmacists essential in the global effort to combat tobacco use. In 2003, World Health Organization member states adopted the Framework Convention on Tobacco Control to address the global tobacco epidemic, a move supported by FIP. The Framework Convention on Tobacco Control required parties to implement measures for promoting tobacco cessation and treating dependence. The 2019 WHO report on the global tobacco epidemic highlights the importance of offering help to quit tobacco, showing that this support has a significant impact, especially when combined with other control strategies. Pharmacists individually or through pharmacy associations play a key role in promoting tobacco control by supporting WHO and power measures. These strategies align with the WHO Framework Convention on Tobacco Control guidelines, have demonstrated effectiveness in saving lives and reducing healthcare costs. The World Health Organization and the International Pharmaceutical Federation have recognized the critical role of pharmacists in promoting tobacco cessation and preventing tobacco-related diseases in enjoying WHO FIP statement on the role of pharmacists in tobacco cessation signed on World No Tobacco Day 2024. This statement calls for pharmacists to adopt a sustainable approach to tobacco cessation and nicotine dependence. It also emphasized the need for continuous innovation in enhancing the role of pharmacists to effectively respond to the public health challenges posed by tobacco. In September 2024, the FIP Council adopted a new FIP statement of policy on the role of the pharmacists in establishing a future free from tobacco and nicotine dependence. Through this statement of policy, FIP urge pharmaceutical organizations to actively support tobacco cessation services in pharmacies by developing guidelines and implementation tools. Pharmacists should take a more active role preventing people from starting tobacco use and are encouraged to utilize digital technologies and other support measures to increase the uptake of effective cessation treatments. Educational institutions should incorporate knowledge on tobacco use prevention and cessation into their curricula and competency frameworks, while governments and policymakers are called to ensure sustainable remuneration for cessation services. In recent years, FIP has actively supported pharmacists in their mission to empower patients to quit tobacco use and has played a pivotal role in advancing tobacco cessation efforts. Through its initiatives, FIP provides pharmacists with the tools and resources necessary to deliver effective tobacco cessation interventions, reinforcing the critical role of pharmacists in promoting healthier, tobacco-free lives. The new FIP publication, Brief Interventions for Tobacco Cessation, a toolkit for pharmacists, serves as a practical guide for pharmacists, offering clear guidance on how to support individuals in their efforts to quit tobacco. It presents the latest evidence-based practice and techniques that pharmacists can use to help patients break their addiction through brief tobacco cessation interventions. Recognizing the fast-paced and time-constrained nature of modern healthcare settings, the toolkit emphasized the need to provide brief but yet impactful interventions to support patients on their tobacco cessation journey, even in the midst of busy daily routines. Pharmacists are encouraged to integrate tobacco cessation brief interventions into their routine practice, ensuring that tobacco cessation services are part of broad health care efforts to combat non-communicable diseases. Pharmacy-led tobacco cessation interventions can be found worldwide. These interventions can range from brief advice to more intensive programs depending on the needs and preference of the patient. Effective tobacco cessation strategies should primarily involve behavioral counseling to increase motivation and provide support throughout the quitting process. These interventions can take the form of advice, discussion, encouragement, and other actions that help the patient succeed in their quit attempts. Pharmacological interventions may also be recommended to help reduce the reinforcing effects of nicotine and alleviate withdrawal symptoms commonly associated with quitting. The key objective of pharmacy led intervention should be to prevent relapse and offer support to the individual in the event of a relapse and encouraging them to make future quit attempts. It is important to note that motivation plays a significant role in the success of tobacco cessation, and the combination of both behavioral counseling and pharmacological approach can significantly increase the chance of achieving long-term abstinence. Pharmacists in the community setting have a great advantage in guiding patients in their tobacco cessation attempts. They are easily accessible to the public and provide a spectrum of preventive services to help improve the health outcomes of patients. Pharmacists in the hospital setting also help patients by advising inpatients with special medical conditions or complications. Hospital pharmacists provide an advantage in terms of direct contact with patients' relatives and caregivers during hospitalization. This is a great time for pharmacists to provide patients and their families with advice and necessary support in promoting cessation. According to the WHO, brief tobacco interventions, also called brief advice, refers to advice to stop using tobacco, usually taking only a few minutes, given to all tobacco users, usually during the course of a routine consultation or interaction. The primary goal of brief tobacco interventions is to help the patient understand the risk of tobacco use and the benefits of quitting and motivate them to make quit attempts. Brief interventions are recognized by the WHO as an effective measure to help people quit tobacco. Brief tobacco interventions in clinical settings are feasible, effective, and efficient, and can have a significant population impact if they are delivered routinely and widely across healthcare systems. According to the WHO, primary healthcare professionals, including pharmacists, can assist in helping patients practice tobacco cessation by asking them about their tobacco use status. If primary healthcare providers consistently inquire about tobacco use and encourage tobacco users to quit, they can potentially reach over 80% of all tobacco users annually. This approach can prompt 40% of users to attempt to quit and assist 2 to 3% of those who receive brief advice to successfully quit tobacco. Pharmacists can assist in changing people's behavior by utilizing different evidence-based tools designed for this purpose. Therefore, pharmacists must ask about tobacco use regularly and offer support. The simplest approach is the very brief advice, or the 3 A's model: ask, advise, and act. Very brief advice is a 30-second intervention that can be delivered by any healthcare professional during almost any consultation with patients who use tobacco. Very brief advice involves asking about the patient's current tobacco use, advising them on the most effective ways to quit, and helping them to access cessation services. The original very brief advice model aimed to refer tobacco users to local stop smoking services for further support. When more time is available, pharmacists should encourage their team to utilize the WHO 5A's and 5R's approach to effectively deliver tobacco cessation interventions. The 5A's model is a valuable tool that pharmacists can use to assist patients who are ready to quit tobacco use by offering advice within 3 to 5 minutes of a patient entering the pharmacy. The 5A's model is designed to be a brief, effective, and practical approach to behavioral change. The pharmacist should enforce this model when any patient approaches the pharmacy counter to ensure the correct process is followed to guide the patient towards a positive behavioral change. The model includes ask, advise, assess, assist, and arrange. The ask step involves asking patients about their health behaviors. Pharmacists should routinely ask all patients at every encounter if they are tobacco users, and their answers should be documented. About tobacco status should be done in a friendly way, not as an accusation. For example, you could ask, do you use any tobacco products? Or do you smoke? In addition, tobacco use status should be included in all patients' records to encourage communication about cessation between healthcare practice. The advice step involves providing clear and concise advice on the behavior that needs to be changed and why it is important. Pharmacists Pharmacists should advise all individuals on the importance of quitting and when talking to them, ensure that their advice is clear, strong, and personalized. Clear advice can include statements such as it is important that you understand you should stop using tobacco now, and I can help you. A firm tone can show that the pharmacist intends to help the patient and build patient provider credibility. An example can include as your pharmacist, I need you to know that tobacco use can cause many future problems, and the best way to protect your health is to stop now. We are here to help you. Personalizing the advice is another way to gain trust from an individual. The advice can be patient specific based on their demographic, health concerns, or social factors. For example, adult women may be more likely to participate in tobacco cessation than men due to increased fertility risks. Many of the patients a pharmacist may encounter will have different health concerns, so encouraging them with advice tailored to address their needs can help promote cessation. Social determinants, such as having children or financial considerations, may be motivators to quit, and formulating individualized questions or statements is highly recommended. This assess step allows the pharmacist to determine how ready the patient is to make a quit attempt and whether the patient thinks he or she has a chance of quitting successfully. Readiness to quit consists of two dimensions. Firstly, the patient should believe that quitting is important, and secondly, that they feel confident in their ability to quit. Here, the pharmacist should ask the patient two essential questions. The first one is, would you like to be a non-tobacco user? And the second one is, do you think you have a chance of quitting successfully? These questions will focus on the patient's desire and ability to quit. If the answer to question 1 is unsure or no, and the answer to question 2 is no, this implies the patient is not ready to quit, and the pharmacist should intervene using the 5 R's model. If both answers are yes, then the patient is ready to begin with a quit attempt, and the pharmacist should implement questions from the assist and arrange examples. The assist step involves working with the patients to develop a quit plan that they are willing to commit to. Pharmacists can aid the patients in developing a quit plan, provide useful counseling, social support, supplementary materials, and other helpful resources, and recommend the use of approved medication if needed. Pharmacists can assist patients in developing a quit plan using the STAR method. This method allows the patient to set a quit date within 2 weeks, tell their family, friends, and coworkers about quitting and ask for additional support. Anticipate the challenge that may occur during the quit journey. Remove all tobacco products from the patient's environment to create a tobacco-free space. Pharmacists should also provide counseling that focus on helping the patients identifying and practice cognitive and behavioral coping strategies to make any risk situation, as some events or activities may increase the risk of tobacco use or relapse. The patient should learn how to anticipate and avoid temptation and trigger situations, and how to make lifestyle changes that reduce stress, improve quality of life, and reduce exposure to tobacco products. Finally, the arranged step involves establishing a follow-up plan to monitor the patient's progress and provide ongoing support as needed. Pharmacists should organize an in-person or telephone contact with the patient for a follow-up visit. The initial follow-up contact needs to be scheduled during the week before the quit date, and the second one can be completed within a month after the quit date. The pharmacist should help all patients recognize and anticipate current or future challenges and the additional resources and support available. The pharmacist should also evaluate the patient's medicines and address any concerns and plans for their next follow-up contact. Patients who remain abstinent should be congratulated to promote encouragement. In case of relapse, pharmacists should remind patients they can learn from their experience and apply it towards future quit attempts. If necessary, pharmacists may also suggest additional intensive treatment or specialists for more support. The 5 R's model is a brief intervention model based on the principles of motivational interviewing to help those who are not ready to change a behavior. The 5 R's model increases motivation to quit tobacco use and includes 5 essential elements of the motivational counseling intervention: the relevance, risks, rewards, roadblocks, vision. Pharmacists can use this model to personalize the message and help patients recognize the relevance of quitting tobacco for their health, identify the risks associated with tobacco use, highlight the rewards of quitting, anticipate roadblocks to success, and reinforce the message through the repetition. By using the 5 R's model, pharmacists can effectively increase motivation to quit tobacco and help individuals achieve long-term success in tobacco cessation. The relevance step involves identifying why the behavioral change is important and how it relates to the individual's goals and values. In the risk step, the pharmacist should assist patients in identifying and recognizing the negative impacts of tobacco use that are relevant to them individually. The reward step involves identifying the benefits and positive outcomes that the individual will experience within the behavioral change. The pharmacist should ask the patient to recognize the advantages of tobacco cessation. In the roadblock step, the pharmacist may challenge the patient to identify particular barriers to quitting and provide solutions that could help manage this. The repetition step involves establishing a plan for regularly practicing the new behavior until it becomes a habit. The pharmacist should continue evaluating the patient's readiness to quit tobacco use. Repetition is encouraged to be performed at every visit when an unmotivated patient approaches the pharmacy counter. Overall, the 5 R's model is a practical and flexible approach to behavioral change that can be applied to a wide range of habits and behaviors, including health-related behaviors, lifestyle habits, and personal development. By addressing the key factors that influence behavioral change, the 5 R's model can help individuals increase their motivation and confidence and eventually achieve their goals. To learn more about the 5 A's and 5 R's models, I encourage you to explore the flowchart in the toolkit which provides guided questions to ask patients at each step of the process. Summary: as pharmacists, you are in a unique position to support patients in quitting tobacco through brief evidence-based interventions. By using brief interventions, such as the very brief interventions, the 5 A's and the 5 R's models, pharmacists can provide practical evidence-based support to help patients quit tobacco use. The new FIP toolkit equips pharmacists with the necessary strategies to effectively guide patients through tobacco cessation, contributing to better public health outcomes. By integrating these services into your routine practice, you can play a vital role in reducing the global burden of tobacco-related disease and improving patients' quality of life. For more information, see the FIP publications that empower pharmacists to help patients quit tobacco use. All of these resources are available on the FIP NCDs microsite. Thank you very much.